Okay, so our next keynote speaker is going to talk to you or address what Maria, elaborate on some of the figures that Maria actually presented. Maria talked about the 3.89 unemployment rate, and she indicated when she did that that doesn't tell the whole story. So our next keynote speaker is actually going to tell the whole story so that we can understand our region a little bit better. But before we get to that, I want to introduce the person that's going to introduce her. And the reason I'm so excited to do this is because Bobby Watt-Geer is actually who introduced me to the ALICE reports. And Bobby Watt-Geer, as we all know and love her, is the current president and CEO of the United Way of Southwestern PA. We are also fortunate to have Bobby serving on the Human Services Policy Committee with the Institute of Politics. Prior to becoming the CEO of the United Way of Southwestern PA, Bobby served in a variety of leadership positions, including Senior Vice President of Administration, Regional Vice President, and President and CEO of the United Way of Westmoreland County. She has taught undergraduate and graduate level courses in nonprofit management and leadership at St. Vincent College and Robert Morris University. And she has served as a nonprofit consultant for the former Duquesne University's Nonprofit Leadership Institute. She has extensive nonprofit experience. I know this because she was my advisory chair, board chair, when I was with the Greater Pittsburgh Nonprofit Partnership. She served as the president of the Community Foundation of Westmoreland County. She's a proud Pitt alum. She's earned her doctoral degree in public administration and public policy from the University of Pittsburgh, as well as her bachelor's of arts degree in communication from the University of Pittsburgh at Johnstown. So, Bobby.
Good afternoon, everyone. It's so nice to see all of you here today. Thanks for the lovely introduction, Sam. It's always good to see you. I got a little worried when she said the current president and CEO. I thought, uh-oh, is there other news? I am really happy to be here with you this afternoon, and especially happy to be introducing you to our next speaker. We often hear references in our community to the poverty level or the poverty guidelines. And here in Allegheny County, you may know that it's about 11% is the poverty guideline, fairly consistent in our region. But what you probably do not know is that the poverty guidelines are not a very robust measure of struggle in our community, and that nearly 40% of Allegheny County residents don't earn enough, even though they're employed, to meet their basic needs. So when our guest speaker realized how inadequate the poverty guidelines were, she researched and created a new framework for us to think and to act. Dr. Stephanie Hoops first developed the ALICE, which stands for Asset Limited, Income Constrained, Employed framework in a pilot study of a low-income community in Morris County, New Jersey, while she was at Rutgers University, Newark, and has since overseen the expansion of a national effort so that we have ALICE data for all 3,000 counties in the United States. We use this data here in our work at United Way of Southwestern Pennsylvania, and I'm willing to bet that after you hear from Dr. Hoops, you will as well. Stephanie is the National Director for United for ALICE at the United Way of Northern New Jersey. She is a graduate of Wellesley College, earned an MA at the University of North Carolina, Chapel Hill, and then a PhD at the London School of Economics. Her career has included teaching and research at Columbia University and Rutgers University, and while at Rutgers, she volunteered at the United Way of Northern New Jersey, and that's where she began her work on the ALICE project, which led to her launching the first pilot in 2009 that really highlighted the structural mismatch between basic wages, and the cost of household basics. When I asked Stephanie to share some information that wasn't necessarily part of her formal bio, she shared a few good insights that I'd like to share with you. She has taught politics and political economy for many years, so getting this invite to an Institute of Politics hosted program was a particular honor for her and something near and dear to her heart. She lives in Delaware, and she points out it's so small, you know all of your elected officials, including the President of the United States now. And finally, and reluctantly I share this with you, she is a Philadelphia Eagles fan. A fact which I promise not to hold against her and perhaps encourage her to venture down a floor or two for some inspiration in the black and gold. With that, and without further ado, I'm happy to welcome Dr. Stephanie Hoops.
Uh-oh, I don't know if I'm going to get past that Eagles problem. Sorry, I shouldn't have shared that. All right, let me figure out the clicker here. And okay, so I think we're all getting to know Alice now. Asset limited, income constrained, employed. We have a very technical definition, but we all already know Alice. Alice is our workers that we run into. Probably you ran into many Alice workers on your way here. Someone at the coffee shop, dropping your kid off at childcare, the security guard at the parking lot, at your bank. Alice is in jobs that keep our economy running smoothly and we rely on. We also know a lot of Alice families, and certainly during the pandemic we saw them struggling even more with getting enough food. And one of the poignant parts of the pandemic for me was seeing those families in a parking lot outside of McDonald's trying to get Wi-Fi so their kids could do their homework. So things like that really stood out. So our job of introducing Alice to communities has gotten a little bit easier, for better or worse. And let me tell you a little bit where this research is coming from, just to help ground our thinking before we dig into the data. So United for Alice is a national research organization. We're based out of United Way of Northern New Jersey, and we provide data for all counties, all communities across the country. We do work with partners in about 30 states and do a deep dive. And so Pennsylvania has been one of our earliest partners, and so have a lot of great data and work that's happening here. One of the key features of what we do is in each state where we do that deep dive, we have a research advisory committee. And hopefully you all recognize some of the names on this Pennsylvania Research Advisory Committee, a stellar group, and have been fantastic in helping us access local data and think about, how does this information fit with what we already know about a community and what we know about the state. So let's look at the actual Alice measures, the nerdy data part. So as Bobby already mentioned, we know in across the US, about 13% of households are below that federal poverty level. But there's another 29% who earn above the poverty level, but below the bare minimum to live and work in the modern economy. And we call that the household survival budget, or the Alice threshold. And so when you add those two together, 41% of households in this country are struggling paycheck to paycheck, having to make tough choices just to meet their basic needs. In Pennsylvania, close to the national average, it's 29%. So when I talk about Alice, I'm talking about that one slice. When I talk about below the Alice threshold, it's Alice and poverty together. And just for comparison, Pennsylvania ranks 23rd across all US states in the percent of households below the Alice threshold. So let's dig in and look at what this is all based on. This is the household survival budget for Pennsylvania, and it includes just those basics: housing, childcare, food, transportation, healthcare, a smartphone plan, and Alice pays taxes. We're very transparent about this. The federal poverty level is a black box, and you don't really know what's in it. But we are very transparent, and in this example is a single adult, a senior adult household, and then a family of 4 with 2 children in childcare. So, for example, the single budget in Pennsylvania is about $26,000. The federal poverty level is less than $13,000, so less than half. So it really is not capturing what is needed to just get by in this state, and for that matter, any state or any county in the country. So this graph really is the crux of the problem. On the one hand, the blue column is the household survival budget, so the cost of all those household basics for a family of 4. The far left column is the federal poverty level, the gray, so you can see how irrelevant that is. And then the 2 middle columns show an example of a family of 4 with 2 adults working in the most common occupations in the country. So retail sales and a cashier. And so even when those adults are working full-time, year-round in those jobs here in Pennsylvania, they fall short of that survival budget. This data is from 2021. There were some unique extra assistance during that year, including the child tax credits, the child dependent care tax credits, and the economic impact payments. So those are all in green, and you can see that fills in some of that gap, but it still doesn't get that family up to the survival budget. And now we know that the tax credits are reverting back to their lower amounts, and the economic impact payments are going away, and that gap is getting bigger. So one thing I just want to point out with this is identifying a structural problem that we have in our economy, that this is full-time, year-round working, and it's not enough. This is not a family not trying hard, it's not a moral failing, it's not being lazy, it's that jobs don't pay enough to pay those basic expenses. And so that's a problem for all of us, and as we think about solutions, it's important that it's not the problem of it's not Alice's fault, it's all of our problem. So looking at Alice data over time may give us some insights as to where we might want to go. The bottom line in this graph, the dark blue, is the poverty, the number of households in poverty here in Pennsylvania, and you can see it's pretty flat through the Great Recession, through the, quote, economic recovery, and even pretty flat during the pandemic. The middle blue is the number of Alice households, and we saw that number increase during the Great Recession. We saw it continuing to tick up during the economic recovery. We had a little bit of improvement right before the pandemic, and then the pandemic hits, and it goes back up again. And then the top line, the yellow, are households above the Alice threshold. So you can see the different trajectories here over time. We're also very anxious to see how 2021 numbers play out in light of what we were just talking about with pandemic assistance going away. Oops. So where does Alice live? Alice lives across the state. There's no county without Alice households, and yet there is variation. And there's the lowest rates are in Montgomery County and Chester, and the lowest rates are Forest, Cameron, Fayette, and of course Philadelphia County. I also highlighted Allegheny County here, which has 37% of households below the Alice threshold. But even that county level obscures some pockets, or actually even large areas, of financial hardship. So for example, digging in here into Allegheny County, we see that in Pittsburgh, 47% of households are below the Alice threshold. So let's look at who is Alice, breaking down by different demographic features. And before I do that, I just want to say very clearly that there are ALICE households of all shapes and sizes, of all race and ethnicities, of all gender, all age, all family composition. It's not unique to one. But there are some groups that are disproportionately impacted. And so in terms of race and ethnicity, Black and Hispanic households in Pennsylvania are more likely to be below the ALICE threshold. In terms of age, younger and older households are more likely to be ALICE. And in terms of family composition, single parent and especially female-headed households are more likely to be ALICE. One of the graphs in our reports that I think is so helpful looks at all of these groups, and it includes the numbers as well as the percentages. So the percents are in the bars, so you can quickly scan down and see which groups have the bigger bars, the more blue and light blue, and which ones have less, so you can get a sense of that. Some of them are relatively small groups in terms of numbers, and you can check that on the left-hand side. So a big part of ALICE is the working part, and as I mentioned at the beginning, we really rely on ALICE for our economy. And so we do a lot of digging into where ALICE works and understanding how that plays out. So in Pennsylvania, 60% of the most common jobs in Pennsylvania pay less than $20 an hour. And when you look at some of those occupations, we're also able to determine how many of those occupations are ALICE workers. So for example, the #1 job in Pennsylvania is a personal care aide, earning $13.65 an hour, and yet 44% are below the ALICE threshold. We also see high numbers of cooks, waiters and waitresses, fast food preparers, nursing assistants, cashiers, all with high percentages of ALICE workers. But even in jobs that you might not think that there are a lot of ALICE workers, there are. Certainly lots of drivers that we relied on during the pandemic, delivering things to us, as well as customer service representatives. And even in higher paying jobs, there are ALICE workers. And in part, that depends on your family composition. During the pandemic, I had appendicitis and was in the emergency room with almost no one else, so I had lots of time to interview my caregivers, and one of the nurses was definitely ALICE. And I'm thinking, I know what your salary is, how can you be ALICE? And she was the main bread earner for a large family, and she worked really hard to make sure that that happened. So just something to keep in mind, ALICE isn't always who you expect. Here's a slide on savings, and asset limited is a key part of ALICE. And also this graph is one of my favorites because it's simple, but it shows the problem of relying on averages. So 64% of households across the state of Pennsylvania have enough savings to cover 3 months of expenses should they lose their job or get sick. But when you break that down above and below the ALICE threshold, you see a much bigger gap. Only 44% of households below the ALICE threshold have that kind of savings, whereas 73% of households above the threshold have that savings. So by being able to break it down above and below the threshold, we're able to get a much better insight into the very different realities that households are facing. So one of the challenges with our data is it is a lag because we are dependent on the American Community Survey. And so the 2021 data tells a story up to a point, and yet we know things are continuing to change. So based on the Household Pulse Survey with November 2022 data, we see some very concerning warning signs on the horizon. So looking at things like the percent of families who sometimes or often do not have enough food in the prior 7 days. 16% of respondents in Pennsylvania reported that. 21% reported that they were behind on their rent. And 22% of respondents below the ALICE threshold reported that every day in the last 2 weeks, they felt nervous, anxious, or on edge. So these tell us that things are continuing to be hard for Alice, and that even if we got through 2021, this is not a time to be complacent, that it's important to pay attention to the way the economy is changing as policy has shifted. So to highlight, I wanted to share a few of the policy implications. I, of course, think that this data is just interesting on its own, but there are additional reasons why we all need to be paying attention. So the first is very straightforward and should be obvious, but the federal poverty level is grossly underestimating need in our country. And because of that, a lot of struggling households are not getting the assistance that they need. Most public assistance programs are based on the federal poverty level, and even government agencies are recognizing that it's inadequate and therefore are using multiples of the federal poverty level. So 138% of the federal poverty level, or 150% for programs like SNAP or Medicaid. But even a multiple of an arbitrary number doesn't seem to be quite adequate, and we can see that there are big differences. Another reason that it really matters is that because the cost of living varies across the country, and because wages vary across the country, there are regional differences, and those are not captured through the federal poverty level, which is the exact same number in every state across the country except Hawaii and Alaska. So the ALICE measures are able to help us understand where those bigger gaps exist. And then another thing that I think a lot of you are probably already aware of, but many of those lowest paid workers are getting public assistance. So by not recognizing that disconnect, in a way, government is subsidizing employment for a number of workers in our country. And then two important economic factors. One is that by not recognizing this level of financial hardship, that our economy is very vulnerable to disruption, that families without savings, without cushion, something like a pandemic hits, it really threw a lot of families in a direction that they could not handle. And as a result, in that instance, we saw a huge amount of government response. But Alice is having emergencies every day, whether it be a flat tire or a broken radiator, or your hot water heater breaks, no cushion. Those are huge challenges. I often hear these heartbreaking stories about somebody broke down their car, then they couldn't get to work, they didn't get paid, they couldn't pay their rent. So the spiral happens, and you think it's theoretical, and then you hear it actually happening to somebody. Somebody's wasn't able to pay a parking ticket, and it spiraled for like 2 years, and they ended up losing their house. Like, some of these things you can't believe happen, but so it's puts your economy at risk. And then finally, it limits growth opportunities. If you are just trying to be able to afford those household basics, you're not buying other consumer goods. You're not a very good customer. So it limits the amount that our economy can grow in the future as well. So with that, I've broken up my presentation into kind of 3 parts. So I was going to break after this and see if there's some questions before moving on to the next 2 sections. So any questions on the data? Any response to? You all seem to be paying attention. Anybody want to share an Alice story? All right, we have a hand over here. That's a great question. So the question was about, have we looked at the impact of student loan debt? And we get that question a lot because a lot of Alice students have loans. And this data does not include things like investment in education. It doesn't include retirement savings. This household survival budget is the bare minimum. And it is not, sometimes it's hard to present because it's not a good budget. It's not an aspirational budget. It is just the bare minimum. So even with that, families are struggling. You layer on something like student loan debt, you can really understand, why so many of Maria's statistics of people dropping out and people not going to college after high school, it's beyond the means of that budget. It's a really good point.
And it was 2021 data. And I'm just wondering what your timeline is for having 2022 data, just because we recently had a USDA report released that showed 2022 saw the largest increase in food insecurity since largest one-year increase since 2008 and the highest numbers and rates since 2014. So we know a lot more people are now struggling to pay for food, that food costs have gone up by 17% in the last few years. So I'm wondering just what your timeline is to having those numbers updated to more recent data.
Great question. So we will be updating the data. The next release will be in the spring of 2024. But we see food banks and food pantries as the canary in the coal mine. When we see that food insecurity, that is often the first place Alice goes, that Alice may not be eligible for any other assistance, and yet you all have no eligibility requirements. If you need food, that's the only criteria. And so when that increases, that's often the first port of call for Alice, and that when those numbers are going up, we see, more things to follow down the road. So that gives us great pause when that report came out. So, yeah.
We've all heard the term working poor that's used a lot. It's probably not the most politically correct or euphemistic term, but is Alice sort of a nicer way to characterize that, or are there differences between those two groups?
Yes, in general, that's probably the closest term to Alice would be the working poor. We worked hard to come up with a name other than that because we felt that the way the word poverty and poor is used in this country brings a lot of moral connotations to it. A lot of folks do see people in poverty as lazy or have some moral failing, and we really want to move away from that. That's not helpful to the conversation. So we came up with the acronym that was also a person's name to help try and for everyone to think of people that they actually know that are in this situation and not try to make it, some group over there that is laden with that. So, but I do want to be clear that the ALICE data includes all households. Most households have someone who's working, and almost all households have someone who wants to be working, has worked. So we do want to be inclusive in understanding our communities and do a lot of breakdowns into those combinations. But one of the largest groups that we see of ALICE are seniors, that the Social Security gets most seniors above the poverty level, but it doesn't get them to that survival budget. So that is actually one of the largest groups of ALICE households. All right, great questions. Okay, let's keep going. We got more to come. Next, looking into inflation, so inflation measures the change in cost of goods and services. The most common measure of inflation is the Consumer Price Index, and that measures all the goods and services that all people in the US buy on a regular basis. It includes things from scuba gear and power boats to, food, restaurants and clothes and curtains and computers. And so what we noticed is the change in the cost of those goods is different from those household basics that ALICE purchases on a regular basis. So we developed the ALICE Essentials Index. So the yellow line is the ALICE Essentials Index at the national level. And from 2007 to 2023, it increased at a rate of about 3.3% annually. The blue line is CPI, the Consumer Price Index. That increased at about 2.5% annually over the same time period. So you can see on a regular basis, the goods and services that Alice buys are increasing faster than the overall rate of inflation. The gray line is change in the median wage for a retail salesperson. And for a long time, that lagged both CPI and the Alice Essentials Index. Just before the pandemic, it crossed over and started increasing faster than CPI, but never really caught up to the Alice Essentials Index. And I'll show you in a minute why that's really important. But I do want to highlight that inflation has been very different during that time period. So we broke it down by time period. So you can see during the Great Recession, huge mismatch. The yellow, again, is the Alice Essentials Index, and the blue is CPI. So during the Great Recession, the Alice goods and services were increasing much faster. Again, during the recovery, they were much more similar in the beginning of the pandemic, and then as we have moved out of the pandemic, this data does show 2022 and 2023, which are projected estimates for both, and then we can see that those things that Alice buys are increasing faster. So there are a lot of tangible, important reasons why this matters, and I included this slide for Pennsylvania because a lot of people ask about what about in rural areas, and CPI is actually based on urban areas. But for the Alice Essentials Index, we were able to separate out urban counties and rural counties. And what we found is that while the cost of goods are more expensive generally in urban areas, they're increasing at about the same rate in urban and rural areas. So the costs are starting lower, but they're both increasing faster. And obviously that there's Alice in rural and urban locations, and one of the differences, maybe you have lower cost of living, but wages are then lower as well. And this is one of the reasons why it really impacts Alice, is that buying power is over a time period. And so the impact of falling behind year after year, so for this retail salesperson, that their buying power was eroded by 4.5% a year from 2007 to 2022. We're like, well, what does that mean? Basically, that means that they were behind $26,000. They would have had to work another whole year to be able to afford the same goods and services every year from 2007 to 2022. So it seems like, oh, you're just falling behind a little bit, and then you're falling behind a little bit more, and then the cumulative impact is really powerful. And you can see it here with some of the other occupations. So we have truck drivers at the top, followed by maintenance and repair workers, customer service representatives, retail sales, and then the only group that saw their buying power actually tick up at the end of the pandemic were food preparers. And yet we know that they're starting at such a low spot that there's still a large number of Alice households. So again, let's look at why this is important. Inflation is definitely hitting Alice harder. A household pulse survey showed that Alice was more likely to have to switch to not using a product at all or to a lower quality. Alice was more likely to reduce their savings or delay a major purchase, more likely to have to work or get another job to fill in the gap, and also more likely to increase borrowing. In a separate survey, we also saw that Alice was more likely to see their rent increase than households above the Alice threshold. So, point after point, we see this impacting Alice. Other surveys show that Alice households were twice as likely to find inflation being stressful. So 59% of Alice households reported inflation was stressful versus 29% above the Alice threshold. And we have policy implications here too. It has just so many places, and once you start to think about it, it'll make sense. But starting with the Federal Reserve's inflation policy, one of the ways that they try to get down inflation is raising inflation rates and basically to slow down the labor market. Well, Alice needs the labor market to keep going, to catch up. So that inflation policy is very hard for workers at the lower end. And then we see lots of our public assistance linked to CPI and increases. So Social Security, for example, is linked to increase in inflation as recorded by CPI. And so with that, we see all those Alice seniors and Social Security not keeping up. So that, with an aging population, is something that we're definitely keeping an eye on. We also see retirement benefits for civil servants and veterans linked to CPI. So they're falling behind every time that those basic goods increase faster than overall goods. And then we see things like our basic public assistance, SNAP and CHIP, Medicaid, are also linked to CPI. And so the value of those benefits are slightly eroding over time. So when they were initially passed and agreed, those amounts are actually worth less, a little bit less each year. And CPI is also used to increase our tax credits, tax brackets and credits, which again make it hard for Alice to keep up. So I know that that's a lot, but it's, really, it continues to be in the news every day. Last week they reported that inflation is at about 0. I find that hard to believe that Alice is facing 0 inflation. Just talking about rising cost of food and gas. So it's hidden beneath those averages, and that's the kind of thing that we're trying to bring out with this data. So I'm going to pause here. Any inflation questions? One in the back. Oh, I think she wants microphone. Good.
Is there any way to get politicians and media to stop referring to inflation in terms of retirement savings, college tuition, buying a better house, and more to what you're talking about? Instead of seeing people in gated communities flying flags upside down because they're in financial distress.
Well, I think that's what we're doing here. So I thank you so much for being here and listening. And that's what it's going to take, is a lot of people talking about this and pointing it out. Thank you. All right, well, now we're getting to the good part of the presentation. We're going to talk about different ways people have been making a difference for Alice, and hopefully give you some ideas of what you can do from a lot of different perspectives. So there's 2 main ways that we can make a difference for Alice. One is to decrease the cost of some of those items in the household survival budget. How to reduce the cost of housing, make it more affordable, and yet retain quality, or in some cases attain quality. And that holds for childcare, that holds for food, healthcare, transportation, and digital technology. So pretty simple, and yet each one is hard to do. And the other way to help Alice is to increase the income available to households. And so in the short term, that can happen through increases in wages and benefits, tax credits, and we certainly saw what's possible with tax credits during the pandemic. And one of the things that we are following very closely are some of the guaranteed income pilots across the country. So lots of short-term ways to increase income, and I want to reiterate, there's a role for everybody to play. It's not just politicians. Employers can certainly make a big difference for Alice immediately, and communities and nonprofits are very central to this as well. And then in the long term, what are ways that we can make a more vibrant economy and improve chances for folks to get better jobs? A lot of what Maria was talking about, so I'm excited to hear about that through education and training. We have a fantastic table in our data, and just wanted to kind of highlight that for you. It's the benefits of sufficient income. So we have it for all of our categories. I'm just going to zone in on housing, and want to point out that it's really important to think of the benefits for Alice. Like, we all can see what a difference having more affordable quality housing would make. But there are also benefits to the entire community. And sometimes people don't want to make action, to help other people, but they're more willing to take action to help themselves. So I'm offering this as another tool or argument in your arsenal to help make the case for making a difference for Alice. And we certainly know that when families are more stable in their housing, that there are much broader benefits for a community in terms of stability, benefits for employers in terms of employees being able to come to work and focus on work. And so that there's two different ways of looking at our actions here. So there's some practical things that we're going to get into, but I also, kind of to the last question is, lots of people are talking about Alice right now, but they're not using the terminology, and they're certainly not using the data. We can get Alice into those conversations. It doesn't take a lot to pipe up and say, hey, you know what we're talking about here? These folks who are feeling invisible, forgotten, left behind, they're Alice, and they're not invisible. We have data right here that we can quantify how many Alice households are in your community, are in need. So that there's a distinct thing that we can all be doing immediately. And to that end, Bobby Watson-Gear has done exactly that. I don't know if you all saw her op-ed in the Pittsburgh Post-Gazette last week, but really raising Alice's profile right here in Pittsburgh. So awesome job. Do you want to say anything? Are you? All right. And so more concretely, an example that I thought might be relevant to some of you here is in Michigan, the governor created a poverty task force, and on the introductory descriptive page, links to the Alice website. So this Michigan task force came up with 35 policy recommendations in round one. They're on round two now. And so just a great example of what a state can do when thinking about, all the issues that are facing Alice. And I think one of the reasons I want to highlight this is certainly we can start to chip away at the problems by looking at, a housing policy here and a child care policy there. But when you look at them together, it's even more powerful. And I'll talk a little bit more about that. But the Michigan Poverty Task Force is something that, might provide some ideas for you all. The other is, and this is linked in part to the current conversation, when there's an environmental disaster, Alice is impacted. So there's an opportunity to insert Alice into the conversation. But it's also an opportunity to partner with maybe some unlikely partners. And so folks who care about air pollution and lead paint and lead in the water should also care about Alice, but they don't always think about that. And so the direct impact of these disasters on families, on low-wage workers, you just think about in Flint, Michigan, when the problems with all the water, Alice didn't have extra money to go buy bottled water. That was just not in the budget. and just, one of the many examples. There's also some really interesting but super nerdy work happening on how to repair the water and sewer infrastructure, which again is based on a misunderstanding of most communities. The cost of those repairs is supposed to be spread equally across all people in a community, and Alice's ability to contribute to infrastructure on the sewer is almost non-existent. And so a lot of cities and communities are having trouble raising the money to make these repairs that everybody needs. So for you total policy nerds, there's a huge place to bring in Alice, but I think you all get the bigger picture. All right, and then I have just a few more tools and resources to share with you so that you go away armed with some great ways to start tackling this in your own work, and a couple of examples using the tools. So first port of call should be unitedforalice.org, and in the National Research Center, pick up Pennsylvania. And there's loads of data, there's reports, and the data on the website you can also export. So you can build a county report, you can dig into the demographics, the budgets, the labor force, and on most of the pages, you have the ability to select one or several counties. So if you're trying to build a regional report, you can put in all the counties in Western Pennsylvania, in greater Pittsburgh, to make the exact kind of report that you want, and the graphs and the data will reflect those exactly. One of the things I love to do on the website, you can tell I'm a total data nerd, is mapping where Alice lives with resources. So on the mapping tab, you can see where Alice lives. The darker the blue, the higher the percent of Alice households. And then you can map that with things like libraries. And so is there a community with a lot of Alice households but no library? You might want to see, gosh, it's a high percentage of Alice households, but it's a low number. So maybe they couldn't support a whole library, but maybe we need to get that mobile library to go there on a regular basis. And so you can map that with health facilities, with banking opportunities, higher education. So a lot of just, looking at your local community from different perspectives. For you politicians, we have a tool that you can look at Alice in your legislative district. And so lots of folks are like, no, Alice isn't in my district. Alice is in your district. And it also, on that tool, breaks it down by race and ethnicity, so you can get an understanding of that equity issue as well. We have a page that's called Alice in Action, and so you can type in your area of interest, housing or mental health services, and see how other folks across the country are using the Alice data. Might give you some ideas and possible partners. And then our newest tool is the Alice Economic Viability Dashboard. So this is a way of looking at work, housing, and community support all together. And the goal is for a community or a state to be balanced and to be strong in all three. And the reason we built this is because we noticed in many communities that you're strong in one thing, that communities that have great jobs, people can't afford the housing. And communities that have housing don't have many jobs. And some communities provide amazing supports and some hardly at all. And so this is a way to really understand what's happening in your community. So this tool is for all kinds of stakeholders, community planners and economic development agencies, everyone in the building world, from builders, developers, housing advocates, zoning experts, certainly all policymakers of all geographic levels, and then nonprofits and even so social services, education, as well as organizations like Chamber of Commerce. So go into the tool and you can click on work, housing, community, and see how your community is doing in that area. So here in Pittsburgh, I picked Pittsburgh City North. We can see that 65% of workers below the ALICE threshold make enough to support that survival budget, which means 35% are not earning enough. So that gives you one perspective on the community. And then you get a better understanding of where are the gaps and how your community compares. So here in Pittsburgh North, in this example, the community score was average, the housing score was well below average, and the work score was about average. So if you're wanting to do something in Pittsburgh North, all right, let's focus in on housing. That's where the real weakness is. And you can see it's scored here. The darker the green, the higher the score. So when you see those kind of light green or gray numbers, Pittsburgh City North really pops out in terms of housing. So pinpointing the problem. So you see the low housing score and go to the tab on the economic viability dashboard that is the action planner. And so you can go in and see quantified a lot of the challenges. How many households are paying too much for rent? One of my favorites is how many renter households are paying more than the cost of owning a house? So here's a case of, renters, if they could just get to be homeowners, would actually be spending less on their housing. But we all know there are lots of barriers to ALICE becoming a homeowner. Often it's, that down payment or qualifying for a reasonable mortgage. So there's things that banks and community organizations can do to get ALICE over that hump. How many renters are we talking about? In Pittsburgh North, it's over 5,000. In other communities, it might be 200. It gives you a sense of how big of a program you need to create or how many partners you need, but a real concrete way to make those next steps. A lot of the data is reported by race and ethnicity. So in this example, homeownership by Hispanic households is really low. So that might be a group that you would want to target. And then taking action. And I keep including all these stakeholders on the slides because even if you are one of those, you probably should be partnering with the others. That it's when the people working on jobs realize the importance of housing that big changes and the right changes are going to be made. And lastly, on the dashboard is a list of promising practices. So you can go down, dig into, all right, here's the problem I'm trying to solve. How have other people done that? And choose the practices that might be relevant to you. And this is one of the reasons why I love meeting with groups like this and working with local United Ways is because you all know your communities better than anybody. You're best placed to take this data, look at other examples, and figure out what's going to work where you live. And that's the way progress is going to be made. So with that, I'm going to pause and see if there are any more questions. Back corner.
Hey, Stephanie, this is Josie. Thank you so much for this. This is really insightful. I'm curious, and I apologize for asking you to go back like 20 slides or so, but you had said when you started talking about policy recommendations, there's sort of like two different pathways, right? We can think about giving people more money or more resources, or reducing the cost of items that are in that bundle of goods. I'm wondering if we have any data on what ALICE households are actually spending their money on. And not to say that I don't think they're spending their money wisely, but just to say I think there are systems that are pushing them to spend money on things that aren't this bundle of goods. Like, I'm thinking of pernicious payday lending and what is the cost of that, and other practices that eat up the resources that they do have. And I'm wondering, do we know anything about that? And are folks like the Michigan Task Force thinking about comprehensive approaches that take that into consideration as well? Or is there just not good data on that so that we can't make it actionable?
Yeah, that is an awesome question, and payday lenders are certainly a pernicious problem for Alice, and yet we have to pause and think about why there are so many payday lenders. It's because they're being used, and in part, that's because Alice isn't often able to use some of the banking system, doesn't have a bank account, doesn't qualify for those special loans or other financial products that many of us take for granted. So it's folks who, it may sound irrational to borrow that money to keep your electricity on, but if your daughter's on a ventilator, it makes sense. And so I know all of you in your work don't make those kinds of judgments, but some people do, and so it's important to understand that there's often something behind doing something that seems irrational. We've been doing some work with the Federal Reserve banks, and one of them has some great credit data, and we're trying to build on a project there. I think that there's a lot of potential for what we could find out, but we haven't fully gotten there yet. But to your overall point, there are so many things that take away from Alice being able to pay for these essentials, and every time that happens, it makes it that much harder, because you need those basics. And so if you're behind on your rent, if you're don't pay your child care and you can't send your kid to child care, it's going to make it harder to work. So all those things add up.
Hi, John Denny from Denny Civic Solutions. Quick question on, do you have any data or anything you can share with us the impact that states who have passed their own earned income tax credit on top of the federal earned income tax credit may have on the impact to Alice?
So we have not done that analysis, but I think it's maybe the Center on Budget and Policy Priorities. Somebody has started to do that, and we're obviously super interested to see how that plays out. The amount of EITC differs. The state EITC differs greatly across states. So to say that it's working, the analysis is a little more complicated. It's not like a yes or no. It's if the EITC is, I think, 3% in Louisiana, it's not going to make the same difference as it is when it's 20% or more in other states.
Hey, Stephanie, I wanted to jump in. First of all, thank you. This has been fantastic. You talked about some of the ways that the ALICE data has been utilized. I think you used Michigan as an example. I was wondering if you could comment on sort of at the policy level what maybe one of your favorite or best uses of the ALICE data that you have seen to implement policy change. And then the second half of my question is, because I really believe that we all have an individual responsibility as well. We want to have systemic change. But have you seen, or could you provide us with some examples about what we might consider in our own organizations or our own communities that we have agency to be able to make some impact on individuals who are living beneath the ALICE guidelines? So sort of the big level policy that you've seen implemented, and then what can we do as individuals in our workplaces and communities?
Great question. All right, I'm going to just come up with a couple, and I'm sorry if I'm missing somebody's favorite, but in New Jersey, the governor increased the child care subsidy rate, which hadn't been increased in like 30 years, and made a huge difference for ALICE families to be able to afford child care. Still low, but that was a big step. And then in Hawaii, they are making solar energy available to low-income households at a really reduced rate. And I love the combination because you can be doing something good for the environment and you can also be reducing your utility bill. And so what a great combination for Alice that way too. So I think that kind of creative thinking we could certainly use more of. And then what can we do individually and in our own organizations? So we all work somewhere where Alice may also work. And so to think about your colleagues who might be Alice, there's lots of things that employers can do to make a difference. Obviously, wages are a big one, but even benefits. You think, gosh, my company offers great benefits. Well, some work we were doing with a company came to us with this problem, like our low-income workers aren't taking us up on the 401k match. We don't understand. And so we looked into it, and it turned out most of the low-wage workers had student debt. And so they weren't able to invest in their retirement until they paid off their student debt. And so the company expanded their benefits to either a 401k match or a student loan repayment plan. And they got a big uptick in people using it, and what a big difference that made. And it was just a more equitable benefit at that point. And then as individuals, we run into Alice, as I started this with, many times a day. And to think about where Alice is coming from just has certainly made me be kinder to people I'm interacting with and ask a little bit about how their day is going and maybe not being as demanding or frustrated when it's not going exactly the way I think it should be. So there's individual kindness we can all layer in there.
Hi, I'm Mark Kritz. I'm with the Pennsylvania Rural Development Council. And speaking of Alice and listening to some of the laments that people can't find employees, it makes me think of my rural friends who are employers who consider not too high a wage to be a good wage. And I'm curious, when you talk about Alice, these are the people that are Alice, is that an entry-level job is $12 an hour, and they think that's a good one. And unfortunately, they have people that are in their system for years who are making 15 or 16 that don't want to see the minimum wage go up, because what does that mean to them? And they are also Alice. So I guess my question is, how do we educate employers that the wage they think is a decent wage is not a decent wage?
Yeah, I think you're right. I think there is an education process there, and certainly employers are more open to learning right now as they're having a harder time attracting and retaining workers. Certainly a lot of workers figured out during the pandemic, hey, it's not worth it for me to work at this rate, that by the time I get to my job, I've used up X amount of, I'd have to work for 3 hours to pay for the gas to get here, kind of thing. And I have a very poignant example from my recent history. My mother-in-law was very sick and needed home health aides, and yet she was, pretty tight with her purse strings, and she only wanted the health aide to come for 2 hours in the morning and 2 hours in the evening. And when I met the health aide to ask them about this, they were coming in and they were literally being dropped off by an Uber. They didn't have a car to get there. And so for that person to have to take an Uber and back in the morning and Uber and back in the afternoon, they probably wouldn't have come home with any amount of money. So my mother-in-law was not a very good employer, and she certainly needed a lot of education, but that's a very small example. But there are a lot of employers who aren't thinking about where their employees coming from, and when you think about where a lot of jobs are located, people have to live far away to be able to afford a house, and yet to get there costs money. But there are other considerations too. Where's the child care? Does the job require a smartphone? Does it require Wi-Fi at home? Additional expenses that Alice may have trouble affording as well. So there's definitely room for that education, but then the employer can get a better employee if they think about those factors too, either supplying that or increasing the wages so that they can have a productive, engaged employee.
Thinking about minimum wage, where does Pennsylvania fall within our region? All of our neighboring states have higher minimum wages than us.
So I don't know of any state that has a minimum wage that supports the household survival budget. So So we did see probably minimum wage. There were a lot of minimum wage increases happening across the country in the last couple of years, and where we saw that impact was on the number of people in poverty. That it didn't really reduce the number of ALICE households, but it was so low that the group that it's impacting are those in poverty, and so. You know, there's obviously a role for a minimum wage, but to date, it really hasn't been able to impact ALICE. One of the challenges that we see with the minimum wage too is, you know, our data shows big variation in cost across a state, let alone the country. So to have one minimum wage is very difficult. It's not going to be, you know, tailored to a location, and so I think that's a hard thing to build into policy. Sure, it's possible, but that's one of the challenges.
Hi, Wendy Koch. I actually have the good fortune, I'm right over here, to work for Bobby at the United Way of Southwestern Pennsylvania, and love this data. We get a chance to talk about it a lot with a lot of people, and everybody's eyes are opened and ask a lot of questions. But one of the things that I didn't hear us talk about today was people with disabilities and how they fit in this category, especially when we're thinking about workforce development across our region and solving some of the problems. How are we factoring in those individuals with disabilities that are probably also living in ALICE?
Yeah, that's a great question. And we do have a recent report called ALICE in Focus, People with Disabilities. So if this is an area of interest, dig into it, because of all the factors that we have analyzed in terms of being ALICE, having a disability, either yourself or in your family, is one of the biggest associated with being low income. So it is, you know, a significant driver of that. And again, you know, thinking about employers having challenges finding good workers, if you can have a more open workplace that allows people with different strengths and weaknesses to be employed, you can get some really good workers. But we see that challenge, and it's the website is really cool where the disability data is. So go into the ALICE in Focus, because you can layer in disability with other factors such as age and race and ethnicity. And when you have that intersectionality, especially with race and ethnicity and disability, the rates of financial hardship get even larger. So it's a really important one to be mindful of. And we've gotten a lot of support from the disability community for highlighting that, focusing that, because they really have not had that data before this report. Good question. All right, well, thank you. Oh, we got one more question. All right.
Thank you. My name is Ellen Mazo. Raising the issue about the worker, the healthcare worker, to go to your mother-in-law's house and using Uber makes me think that when you talk about inclusionary housing and zoning policies, we really need to think about transportation, public transportation. And I think that that is something that needs to be included in what you're doing for ALICE. Because if you can't get, how many people can use Uber? Right. Not many. And even then, even if you can, it adds up. But public transportation, to me, is the mainstay of a community, of being able to, for everybody to get where they're going.
So transportation is a huge issue for Alice, and I'm so glad you brought that up because of all the groups and partners we've worked with in the last year. Departments of transportation have been really interested in Alice, and so speaking to a group of engineers about Alice, you could just see like these light bulbs going off, and suddenly they have started to be interested in who they're building things for rather than what they're building. So I think huge opportunity to engage around transportation, and what an opportunity to make a long-term impact. Transportation projects are 10, 15, 20 years out that we can be making a difference for Alice in the long term. And yet I think Pittsburgh is an example of how hard that is, that there's transportation here in the public transportation here in the city, but it's, more broadly, it's hard in rural areas to have public transportation. And so what are alternatives? And with new technologies, I think there can be better solutions, but I hope that that's an area that the smart brains in this room can start to dig into. But thank you so much. This was a fantastic discussion. I appreciate it.